Let's talk about heart attack. No first aid given on time is the biggest cause of death from heart attack. Do not be afraid and try to give first aid. This can save life. Anyone can call the ambulance, but many unfortunately still do not dare to hurry to give first aid. Doctors estimate that unfortunately with the heart attack outside the hospital today, the chance of survival is only 7%. In this presentation, I will review some statistical data in order to show you the scale of this problem in Lithuania. I will also talk about the signs of a heart attack and what you should do when you recognize the symptoms. Let's review some statistical data. Do you know what the biggest percentage of Lithuanian population dies of the heart attack across the European Union? According to the blog Euroblogas LT, 38% of Lithuanians die from that. On average, heart attack across the European Union is 12%, according to Eurostat data for 2015. Nutrition, overweight, lack of physical activity, harmful habits and lack of information on the most dangerous diseases are the main factors affecting the heart health of Lithuanians. The biggest problem today is what Lithuanians die from cardiovascular disease 3 times more often than people in Europe. The lowest risk of heart disease is in France and the Netherlands. 6% of population in both countries die. If you are with a person you suspect a heart attack, immediately call 112. After the emergency call, you will have about 10 minutes to provide first aid while the doctors are coming. Knowing the signs of a heart attack and knowing how to adhere to the first aid plan for heart attack can save a person's life. Signs of a heart attack. When to call for ambulance. A heart attack occurs when the heart is blocked and blood supply stops. Then the heart muscles start to lack oxygen and various symptoms can occur, including chest pain, shortness of breath, dizziness, sudden cold sweat, faint, feeling anxious. A lot of people just ignore early signs of heart attack. If you see the person is experiencing the symptoms listed above, call 112 immediately. If a person is conscious and still communicative, after calling 112, there are several ways you can help a heart attack victim. If he can take aspirin, give him 324 mg of aspirin. If a person has already had heart problems, he may have nitroglycerin tablets with him. Help him to find the tablets and consume them. Do not offer food or water to a person. Make a list and dosage of medicine he is taking. Help a person feel comfortable and calm him down. If a person has lost consciousness, as long as a person breathes normally, his heart also breathes. There are a few things you can do before you get an emergency. If it's possible, place a person on the ground. Make sure the head is in a relaxed position. Do not bend his neck forward or backward. In this way you will prevent a man choking from saliva. If a person loses pulse. For a person with a cardiac arrest, cardiac massage can significantly increase the chances of survival with intact heart and brain function. Thank you for watching this video. If you are interested in this topic, you can find more information in the following references.